Welcome back to Weekend Prime. I'm Robinson Okenya. Let's now take a look at what is in your favorite health segment, Health Digest. Now, a public health crisis is brewing in the country, one that experts warn could derail the country's quest for equity, quality and affordable health care. The Social Health Authority's failure to settle 43 billion shillings in unpaid claims to hospitals has left many facilities cash-strapped and on the verge of closure. On this episode of Health Digest, Gloria Milimu examines why experts caution that Kenyans may soon be forced to pay out of pocket for treatment if a clear plan to resolve the financial crisis is not urgently put in place. Let's take a look.
This is Mutuine Sub-County Hospital in Nairobi County. It is among health facilities across the country said to be choking under the weight of debt owed by the Social Health Authority SHA. Unpaid claims running into billions of shillings have left facilities like Mutuine financially crippled, and according to its CEO Dr. Martin Wafula, the cash crisis now threatens service delivery.
For levels 2 and 3, for the first time, Nairobi City County got reimbursement from SHA, which is a good thing, because if a facility like Ruai Health Center gets 2 million, it really goes to boost this facility, and they are able to see more patients. Where the challenge actually is on the big facility. That is Mutuini Hospital, that is Mama Margaret Uhuru Hospital, that is Mama Lucy Hospital, that is Mbagathi, that is Pumwani.
The situation is dire. Reimbursements are either delayed or missing altogether, leaving hospitals struggling to meet obligations.
Mama Lucy Hospital was paid only 20,000. 20,000 cannot even buy water for a patient. Mutuini was paid zero. Mutuini Hospital is owed more than 20 million. That is current SHA. You're not talking about the debt for debound NHIF. With debound, when you add debound NHIF together with SHA, you're talking about 1.1 billion for Nairobi City County.
A quick dive into the SHA claims portal depicts an efficient system. In fact, one that gives real-time data on what facilities are owed and for what period. Tracking claims made easy for facilities, perhaps, one would say. However, these numbers in the much-hyped system are yet to translate to cash, and all SHA-accredited facilities like Mutuine can do for now is just stare as the debt grows by each service rendered to unsuspecting members of the authority.
So we have claimed 14.7 million and we have been paid zero amount. When you add now the other cumulative other months, that's when it's coming to around 22 million. Now that is less NHIF debt, which is 45 million. So when you are taking 45 million, add to 22 million, you're talking about 67 million plus. With the 67 million debt, how do you run?
But as the debt continues to grow, experts now warn of an impending crisis that could derail access to healthcare and threaten the future of universal health coverage.
If we keep going down this path, we don't think that we will have a health insurance within the next 3 to 6 months. We won't have. In fact, I think that if the financial crisis is not sorted, by the end of December, a lot of faith-based and mission hospitals will have reverted to cash. The reality of the matter is that if these lower level hospitals, the ones that are owed 5 million, 3 million, 8 million, 500,000, if they collapse, Kenyatta National Hospital or MTRH will not be able to absorb the numbers and volumes of patients, and we will not achieve UHC.
SHA owes service providers 43 billion shillings in unsettled claims, alongside an additional 33 billion shillings debt carried over from the defunct NHIF. Despite President William Ruto in March 2025 directing that NHIF debt of 10 million shillings and below be settled, this is yet to happen, according to service providers. The Social Health Authority had projected it would collect at least 148 billion shillings every year to fund improved services. This projection was anticipated to double the annual collection by the former National Health Insurance Fund, which had raised 82.1 billion shillings in 2022-2023. The defunct national insurer had also paid 74.2 billion shillings in claims during that same period. However, 11 months into its existence, experts say the Social Health Authority continues to struggle with collections. Monthly collections stand at 5.4 billion shillings against claims of 8.7 billion shillings, leaving a shortfall of 3.5 billion shillings every month. As cracks widen in the scheme, experts call for a different approach in order to help ensure the sustainability of SHA.
We need to change the narrative a little bit and start telling people that not only do you need to register, we want you to contribute. We want you to put some money there, and your contribution is going to enable you on a rainy day to get the health care, or even a parent or a sister or a relative of yours to get the care.
So far, 26 million Kenyans are registered with the authority, but only 4.5 million are making contributions, and 3.5 million of these are salaried employees. Gloria Milimu, KTN.